Well, hello and welcome to another edition of Health Solutions with Sean and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Sean Needham, along with my wonderful producer, Lindsay. We are streaming live from downtown Idaho Falls. And today we have Dr. Garnita on. She is a rheumatologist. She's in California, and she is going to tell a wonderful story about a life-saving story about a young patient with lupus who she ends up saving the patient's life. He was unconscious for some time, and she ends up saving his life. And I got to be honest with you, as a pharmacist, I've dealt with a lot of lupus patients over the years, and I didn't know that lupus could actually render somebody unconscious. So you really want to listen to this story. So you got to stay tuned for all of the show to listen to the story. It's a wonderful story. Might even bring tears to your eyes. So stay tuned for that. As always, you can listen to us on Facebook every Thursday, usually 8 to 9 a.m. For our midweek podcast, and every Monday, 1 to 2 p.m. Pacific Standard Time. And of course, catch us on YouTube. Also, we're streaming live on YouTube as we speak. And all these shows will be available later on those forums. So please go to our YouTube site and like the Moses Lake Professional Pharmacy YouTube site. And without further ado, I am going to shortly introduce Dr. Garnita, who is a wonderful rheumatologist and life-saving, as I said, but she's not in the traditional healthcare system. As you guys know, through watching this podcast, we have interviewed many different doctors who have gotten out of the traditional healthcare system, out of the insurance model, and went into more of a direct fee-for-service or direct care model, so they can better service patients. And that's what you'll learn today by watching the podcast. So she's got a wonderful resume. So many things on the resume, I can't remember them all. So with that, I'm going to just introduce Dr. Garnita, and I will let her tell a little bit of her story. She has a wonderful story about why she got into medicine and how she became a rheumatologist. So Dr. Garnita, welcome to our show.
Hi, Sean. Thank you very much for inviting me. And thank you to everyone that is watching us today. As Sean was mentioning, I am a rheumatologist. I was born in Romania, and I came into the United States in 2005, so a long time ago. My story was going to medicine, since none of my family members are in this field, starts when I was a child, and I was admitted one time in the hospital, and I was really impressed with the job of those people and with the respect that patients kind of turn to the physicians. So I put in my mind to become a doctor when I grow up, and I never had anything else in my head, although sometimes I look at fashion, but that was not an option really in Romania. So I graduated in 2001, and I started a residency in Romania in cardiology. And soon after that, I started to be interested in immunology, initially transplant immunology. I came to United States as a postdoctoral fellow, and I did some time at Harvard University, and then I moved to Pittsburgh, where was the largest transplant center in the world at that time. And I had the opportunity to work also for kids with heart transplants to do some research in the field. And I was very fortunate to work with people from universities all over the United States, big names. And after I completed the study, I realized that I want to come back still to the clinical side, not only do research. So here in the United States, I pursue another residency in internal medicine, and then using my background in immunology, I transitioned into rheumatology, which is a newer field, but so wonderful and developing so fast.
Wow, that is a wonderful history and pretty impressive. From cardiology to rheumatology, that's quite a change, huh?
Actually, rheumatology and cardiology are very well connected. As you all know, autoimmune diseases, they do affect the heart. pretty bad. And for many years, people knew that autoimmune diseases like lupus can affect the heart, but they didn't thought about all the autoimmune diseases, all the inflammation that is going on that could affect the heart. And here we are years later that we recognize that impact. So there is a connection there.
That is, I will tell you, Dr. Garnita, thank you for educating us on that. And I will tell you, one of the wonderful things about this podcast is that I get the opportunity to listen to experts in fields like yourself and learn so much. Every time I interview somebody else, I learn something new. And so thank you for that. I feel very honored to be able to interview you. So thank you for educating me and our viewers, of course. So tell us a little bit about your history. After you decided to be a rheumatologist, you kind of went to work in the traditional medical system, and for some reason you got out. So tell us why you got out, and tell us what you do now.
So I started like everybody else in the traditional system. For 4 years, I worked in a big hospital systems, where we were 5 rheumatologists, part of the group, but we worked tremendously hard. I mean, for Cincinnati, we were the largest group of rheumatologists in Cincinnati, and we had a lot of patients. So after a few years, you start to understand the difference between, practicing for the patient or practicing for the system. And as I told you, my drive was to serve the patient, and that was my goal. And after a while, I started to feel like you lose that personal touch to the patient. That was one thing. And then second, the time with the patient was extremely limited because we had too many patients. And obviously you try to serve everybody, but you have to cut from somewhere. You cut from the time, or you cut from the value, and that doesn't bring anything good for the patient. And then, the traditional system pushes you to document everything. So instead of concentrating on the patient, you start concentrating on the documentation to get a better pay, because otherwise the hospital, which judges you as a productivity based on the productivity model, they consider you not valuable. But they all talk about, patient satisfaction and the value of our care. But in reality, we focus more on things that do not bring anything to the patient.
Right. And so tell me a little bit about the documentation, if you'll go into that a little bit. So I think patients do realize that sometimes doctors seem distracted when they're documenting, on their computer, and they're in the room documenting on their computer. So you're telling me that documentation really has nothing to do with the patient care. It has to do with reimbursement from an insurance model. Is that correct?
Yes, that's correct. If you talk to my patients, they will tell you that I never type in the room with them. Besides I put some labs, or I put there some instructions for them when they leave. Other than that, I would never type with them in the room, because I consider that you cannot focus on the patient. But what that caused me is a lot of burnout, because think about, I am a female, a mother, a wife, and I'm a mother of 3 kids. When I was getting home, I had to cut from my time with the family to type notes. And the notes are not easy. I mean, you have to put in the notes a lot of things. And even if you use templates, you cannot copy and paste, okay? You have to construct a note in such a way to be billed and to get the reimbursement that you need.
And so tell me now how your practice has changed.
It changed tremendously. I have a lot of time with the patient. I will give the patient an hour. If it's new to me, it's going to have an hour. And if it's a follow-up, even an easy follow-up just for medication management, the patient will still get a half an hour. And during this time, we have the opportunity to discuss everything from, their history, from their medication, and then they have time to ask me questions. That's another thing. Patients, you focus on telling them what they need to do, but you don't have the time in the traditional model to listen to what they have to say or what's their concern. When you come up with a plan and you bring them in the picture a biologic medication, which if they go on YouTube and they research it, they're gonna freak out. They don't have that opportunity to ask you questions. So what they do, they go back to Dr. Google, they start to research that, and they get very, very scared. And then it starts a whole new process to convince the patient that your plan is valid and your plan has a chance to work. Or they go in all these groups on Facebook, or I don't know, there are all kinds of support groups where people start to express all their frustrations with the system, with the treatments, with their doctors. So they get that personally, and instead of giving the treatment a chance, they get very scared. So it takes us as physicians much more time to develop a plan or to implement a plan that will be actually valuable for them. And on top of that, I do have the time to discuss about what I like the most, to educate them about what the disease means, what's the prognosis of their disease, what's their treatment options. I always give patients options. I don't tell them, you do this because this is going to work. No, I give them options. I'm there for them to coach them to take the best option for them. And then on top of that, I discuss about a lot of things that are important, because that paradigm of treating one disease with, having that target, the disease, and treating with one medication is not always working.
Right. So, and I think, giving a patient options really kind of empowers them with their health, because they take charge of it a little bit. And as you will probably agree, if the patient doesn't, it takes, the patient has to be involved in their own care to have the best compliance and the best results. So giving them options is one way to do that, because then they can take charge of their care.
I agree. This is a two-way relationship. And if the patient does not trust you as the healer, they will not do what you say, or they will do it not properly, or if they don't understand exactly, for them it's a new world. So when you get diagnosed with an autoimmune disease like rheumatoid arthritis, let's say, it changes your perspective tremendously. You get in another way of looking at things. It's not easy for the patients. You don't deliver them with a name and then you move to the next patient. It's a huge impact, especially on young people, on young patients. When you tell them you have a disease that could disable you in 10 years, that's very hard for patients. It's not easy. So you have to spend that time to explain, yes, you do have it, but yes, we have treatment. You have to give them the perspective of all these, 50 years of research, which brought significant change in the outcome of these patients. If we were looking 50 years ago, these patients had absolutely no chance. They will end up in a wheelchair. They will end up, disabled. And that doesn't happen today. So they have to know that. But if you're not there to explain them, to kind of go with the patient through the process of acceptance, of being grateful that they have options, you're there like you're very impersonal. You're not helping them. You give them a pill and then you move on. I don't think that's the role of a physician.
Right. And so you mentioned earlier how cardiology and rheumatology have a lot in common because of inflammation. And rheumatoid arthritis, basically, arthritis in the name is, itis is inflammation. So we talk about inflammation a lot in medicine now, I think, and I think maybe a lot in, more of a functional standpoint, when a lot of the disease processes, whether it be arthritis or probably osteoporosis or lupus, fibromyalgia, there's actually an inflammatory component of a lot of these diseases, and cardiology being one of them. So can you explain a little bit about inflammation. And I know that's a really, really broad topic, but can you explain a lot about inflammation and how, in our lifestyle, whether we have a disease or not right now, how we can decrease inflammation in our bodies?
Yes, definitely. The old paradigm of medicine was looking to, one organ and those diseases associated with one organ. But you mentioned a couple of things that make a lot of sense in rheumatology, and makes a lot of sense recently. We thought that super specializing in one topic will be able to cure it all, or make a huge difference. Actually, all these diseases that you mentioned, they are linked together, because our mind, our soul, and our body is linked together. So we recently, and I've seen that in the last 10 years, we started to accept that there is a linkage between our organs, our mind, and our stress and our inflammatory markers, autoimmune diseases that will be connected in a way. As you said, rheumatoid arthritis can cause osteoporosis. Rheumatoid arthritis can cause heart disease, and that's all connected because of this inflammatory medium in our bodies. Stress, recently stress was linked to inflammation. Many years ago, when I did my PhD, it was thought that there are no immune cells between in our brain or in our spine. But then they realized, no, immune system, which is a very complex system, is very well connected to everything. Okay, it's like we thought that it's defending us towards germs, and that's the role. And we realized that now that's much more than that. Our immune cells are the ones that are involved in triggering inflammation, triggering atherosclerosis, triggering degradation of the bone, and which will translate in osteoporosis. So our immune system, it's probably still a lot unknown about our immune system, but it's very well connected. It's also extremely important to understand that how we relate through our nutrition to the outside medium, it's going to impact our body. So that's why I talk to my patient about how important is nutrition, sleep, the level of stress, exercise into their control of a chronic disease.
That is so, wow. That's a lot. That's a lot there. And one thing I just want to kind of comment on is I think, as humans, we try to compartmentalize. As scientists, we try to compartmentalize our bodies. So, like you say, we try to make it one individual organ, and even the immune system, as vast as we know it is, we try to we tried to kind of minimize it and say, oh, there's no immune system in our brain. But if you think about how our bodies are designed, that's actually kind of very narrow-minded.
Yes.
We should know that everything from our head to our toe affects our body in general. And we only know what we know until we study it. So not until we really studied the immune system in the brain, that goes well beyond my capabilities, did we really find it, because we weren't even looking for it yet. So I love your comments on that. I mean, that's awesome. And it just goes to show how everything we do with our bodies, everything affects everything else. So diet, nutrition, and exercise are so important for any disease state, pretty much, right?
Yes, it's very, very important. We, in the last 50 years, it was a huge push towards accepting, processed food. And a lot of people, they embrace that because they think there's not enough time, or there is not enough resources, or organic food is too expensive, or I don't know how to cook. That's too much for me. My parents didn't cook. I never learned to cook. But cooking is not such a big science. You just have to try it. You have to experience food. And I recently went through a very organized course about nutrition from Stanford University, which kind of brought into my attention how industry changed our mentality about cooking, the process of cooking, food in general. And if we don't pay attention to those things, we will very rapidly fall into their trap because nutrition, it's extremely important for us. It actually gives us the power to live. Okay, if we don't eat, we don't live. So
Right.
what you put in your body is what you're going to become. And if you base your diet only on processed food or fast food or food that you buy already done from a supermarket, is not healthy. And something that I learned that I really, really enjoyed, they said something like, if you go in a store and you look at a label and it has a lot of things written on that label, that's very processed food.
Right. Yeah.
To grow. And if you go to where there are a lot of fruits and vegetables, do you see any label on those? No, there is no label because there is no need. So I love that. I actually started to tell my patients, go there where you don't see any labels. Buy that without any labels. Do you see any labels on salads? No. Do you see any labels on legumes? No. So there is no need for that. So, and then, the other thing that I draw attention to my patients is the amount of sugar that we eat. It's incredible. Everything has sugar here. Bread has sugar, a ham has sugar, you name it. Crackers have sugar. Why do we need so much sugar? So I try to draw attention because I feel like we are kind of trying to disregard that. We know, but we put it on the side, intentionally or not.
Right. Wow. That's great. I love it. I love it, Dr. Granita, that you're, we talk about this. We talk about stuff like this on the podcast all the time, and you are just really hitting home, I think, what we have talked to our listeners and viewers about before. So I really appreciate it. And coming from a rheumatologist that specializes in chronic disease, literally, that's kind of what you specialize in inflammation. And that is a driver of healthcare, I should say sick care in our nation, because so many people are inflicted with all these diseases like that. And, a lot of them could be at least helped with diet alone.
I agree. I think that there are a few components that you have to consider. Medication is there to help one small piece, and it's good that it's there. I never say to the patient, don't take medication. Medication has to be complemented by other things that you do in your life. I mean, the fact that you come and you expect me, and that's something that I learn in time. Patients come to me and they expect a solution. I have part of their solution. I'm there to help them to identify the problem. So what we are treating are just the symptoms, but we don't treat the roots of the problem.
Right.
So if you don't go back in your own environment, and of course we cannot change genetics. The genetics are there, but on the genetics, everybody has genetics behind them. But on that genetics background, we come with our environmental factors, which can mean, nutrition, pollution, where you live, how you live, how much exercise you do, and how much stress you put on your body. We in my generation, the generation that comes after me, although they have everything, we are very stressed. Okay, we are stressed about our job, we are stressed about our careers, we are stressed about money, we are stressed about everything. And if we are not stressed, we'll find something to be stressed about.
Right. Well, and I think what we need to, you talk about, I've heard you speak before, and you talk about mindfulness. We need to be mindful of that. Can you comment on that a little bit about mindfulness?
Yes, I will comment about that. I'm not a trainer into mindfulness to begin with, but I do read about it. I try to practice it, and I try to encourage people to practice it. And the reason is that I learned, guess what, from my patients that were practicing that, one in particular who taught me about mindfulness. I learned about the importance of that. And then I went and researched it, and I found wonderful resources. I mean, very strong evidence, scientific evidence about the importance of mindfulness. And mindfulness can mean everything. Can mean from, controlling your breath or doing some breathing exercises to meditation, but also love, gratitude, the power of a hug. We cannot do that these times, but I'm afraid that we forget about what we have in the present moment, and we concentrate too much about the future, or we concentrate too much about what happened in the past, and we forget to live the moment or to be grateful to what we have at this point. Reading about the importance of psychoimmunology, there is a new field, if you didn't know, about psychoimmunology, how our mood influences the immune system. And you all know that when you are very stressed, you're going to get sick, right? You're going to get the flu. We knew that from our parents. If you are too upset, or if you're too stressed, or if you are between seasons, your immune systems will drop and you will get the flu, right?
Right.
So we knew that, but just recently there are a lot of science and a lot of people, incredibly smart people from, Harvard, Stanford, from Vanderbilt. I look into this because I couldn't believe it in the beginning, how powerful it is. And then many people know about Jon Kabat-Zinn, the doctor who started the MBSR program in United States in the late 1970s at University of Massachusetts. I actually took that course to understand the principles of mindfulness. And it's a wonderful course. I encourage everybody to take it. But you just have to commit to that type of practice. Like we practice, piano, we should practice mindfulness as well. Like we dedicate time to exercise, we should practice mindfulness the same way. And you don't have to be a Buddhist monk, or you don't have
Right.
you just have to take the time for yourself and for your mind. I think that's the most important thing that people have to realize. And it's not easy in the beginning, I will tell you sincerely, because your mind is racing. And what I learned from this course is that it's okay. That's normal for your mind to go wild and race, but just accept it and let it go, which was, again, another concept for a physician. I will tell you this, for a physician, those kind of concepts are very hard to digest.
Yeah. Well, I think one of the reasons why, as healthcare providers, we learn all this science in school, and we kind of get an attitude that we know how to fix something because we learn all these protocols and treatment plans. But in reality, if the patient is not thinking positively, whether it's about their disease or whether it's just about their day in general, it's really hard to heal them. And, I look at it like this. If you wake up in the morning and you think today is going to be a bad day, it's going to be a bad day. I mean, that's just, but if you wake up today and you say you're grateful to be alive, you're grateful God gave you another day, and you're grateful to have to that you have a job to go to work at, you're grateful for those things, then it's going to be a good day. And that's part of mindfulness, right?
I totally agree. Think about the placebo effect on every study. That's what it's about. Patients think, patients hope that they get the right medication, and they hope it's going to be better. So that's why 20% or up to 20% of these people, the placebo effect is huge. So our mind is connected to our well-being. And, I mentioned the name of Dr. Jon Kabat-Zinn because he was the first one who started to use this mindfulness-based stress reduction programs to prove that will impact chronic pain, inflammation. He did studies on patients with psoriasis, which is an autoimmune disease.
Right.
He reacted so much better after 8 weeks in the study doing mindfulness. they improve compared to people that they didn't. And these are studies that you find very easily. Just Google it, and you will be like me, I was never trained into this, but I started to discover what will be something that will help me, my patients, my family, but in particular, patients with chronic conditions.
Yeah, that's wonderful. Thank you for that. That's definitely a good tip for our viewers and listeners. So, I got a question for you. Studying cardiology a little bit and thinking about inflammation, I've heard about this before, and I want to know what your thoughts are on it. So, you talked a little bit about atherosclerosis,
Mhm.
and when we think, first thing that comes to mind to me when I think of atherosclerosis, I think of cholesterol, because that's kind of how we monitor it, sort of. I mean, that's how we maybe initially monitor it. I've heard that, the cholesterol is really just a marker of inflammation. And so we should really be looking at more things than just cholesterol when it comes to cardiovascular health. Knowing what you know about inflammation, what are your thoughts on that?
So that's a very complex process, and I actually was interested into, the link between autoimmunity and cardiovascular disease. And I will tell you briefly that cholesterol is part of our body, has to be there, it's part of what we are. So our body produces cholesterol, genetically or not. I mean, genetically, we are supposed to have cholesterol into our body. We concentrated too much on the cholesterol, and then we understood that there are fractions of cholesterol that, if they're too high or they're too low, that will impact the risk of developing atherosclerosis. And then later on, it was recognized that the bad cholesterol has to be, they recognize the LDL cholesterol as the bad cholesterol, the HDL as a good cholesterol, and they try to analyze that ratio. But in people with a lot of inflammation, actually, we cannot rely on that. So later on, when they look at atherosclerosis as part of the inflammatory process, they come up with the idea to monitor the C-reactive protein. You heard probably about the high sensitive C-reactive protein,
Mhm.
which is a marker of increased risk for atherosclerosis. But atherosclerosis and cardiovascular disease are not related only to cholesterol. I want people to understand that. We look at certain things, we are, narrowing our mind towards cholesterol, when in fact, nutrition, exercise, level of stress are, a combination of factors that will lead to cardiovascular diseases. So I want people to think broad, not look only about cholesterol. Because
Right.
when you come to the doctor and say, hey, okay, I'm going to give you a medication for cholesterol, but that doesn't mean anything. We're going to change the ratio there. But if you don't eat right, if you don't exercise, and if you're extremely stressed, your cardiovascular risk is the same. So that medication will help you just a little bit, as we said before. So
Right.
it's a complex situation. And in
Yeah.
autoimmune diseases, I tell patients all the time, patients that are newly diagnosed with rheumatoid arthritis, especially males, okay? I tell them this. Because many of them, they don't want to be treated in the beginning. They said, oh, I don't want to get on these drugs, they are too powerful, they are too dangerous, and I do not want, I can live with my hands shifted, that's no problem, or in pain, I'll go and take something for the pain. And I tell them, that's not only the problem. Your problem will be, like we said, this inflammation that will reflect on your eyes, on your heart. So when they turn 40 or 50, when they are diagnosed in their 20s, in 10 or 20 years, their cardiovascular risk is 3 times more, because they live in this environment of inflammation. Their body is under constant attack. So, and when they hear about the heart issue, they're more receptive. But you have to tell people that inflammation can affect your eyes, your brain, your heart, and also your lungs, and also your kidneys. So there are a lot of connection with inflammation and the other parts of the body.
Right. Thank you for that. That's wonderful. Wonderful. Okay. So you've got a great patient story and a great patient success story of a young lupus patient where you essentially saved his life. Can you tell us a little bit about that story?
Yes, I will tell the story. It was pleasure. Actually, I published this case with one of my residents. So this is a 22-year-old, very young, of course, African American gentleman that a few weeks before he was admitted in the hospital, he was doing exercise and he had to stop doing his exercise because he started to have severe pain in the left calf, something like that. So he went to the emergency room because he was in tremendous amount of pain, and they told him that he probably, had a sprain of a muscle or a tendon or something like that, and he was sent home. A week after that, he was again in the emergency room because he had acute shortness of breath. This time, they looked further. They diagnosed him with a pulmonary emboli. He did not have any, risk factors. I mean, he was heavy, but pretty active. And they diagnosed him with a pulmonary emboli. They start the anticoagulation, and in 3 days, they sent him back home. So a few days being home, this young guy who was working in a bank, so a very respectful gentleman, he started to be very confused, combative, and he lost his consciousness. In a couple of hours, he started to transform from a normal person to someone that lost his consciousness. So they thought maybe he had a brain bleed or something. So they brought him to the hospital. The gentleman ended up in the ICU. And being there in the middle of all these tests that they were doing, they also did a CAT scan of the head, and that was followed by an MRI. And they showed that he had severe inflammation of his brain. So nobody knew why this young gentleman would have something like that. And luckily for this patient, one of my residents, a young lady that is doing rheumatology today, actually, she rotated with me a few weeks before she saw this case. So she went straight to his family, asked questions, and they identified that maybe someone in the family had lupus or something, autoimmune disease. The question was an autoimmune disease. So the resident ordered the NA is positive, and guess what? With a positive NA, who do they call? The rheumatologist, of course. So I got involved in the case, and indeed the patient had lupus with brain involvement, actually. That's why the patient had actually a clot in his leg, which actually then transformed into a clot in the lung. And then because his disease was wild at that point, he ended up with inflammation of the brain. We treated this gentleman, and from someone that was not able to talk, I did not talk to him at all through that whole hospitalization. From a gentleman that was not able to talk, when he came to see me in the office, he was walking, talking, and today he is back to his normal life. He was saved.
Wow, wonderful story. I mean, basically the timing and all that they were able, that resident of yours, was able to recognize that and then, do the test and call you. I mean, basically you saved the guy's life probably because other than that, they were just going to give him life support measures probably, right? Because they didn't know what was going on. They didn't know how to fix the issue. I mean, I can tell you I've treated, hundreds of patients that have had lupus in my, 25 plus years of being a pharmacist. And I've never, ever heard of a case where a lupus patient was unconscious from lupus. I had no idea that it could affect their brain like that. So, I mean, that's a wonderful success story. And I'm so glad that you were there to save that patient's life. So what a great story.
Thank you. It's just the exposure, just to recognize certain diseases. It takes a little bit of time. But people that are trained in rheumatology, they know that we ask about everything and we take that time, and that's what we need, to take the time to kind of dig in the story, especially when you have a patient without risk factors, a patient that cannot give you the story, and you just dig through the files, try to understand what happened in the last 3 weeks.
Right.
So dramatic. The family was all there, and they did not know. They were keep telling me that he is healthy guy, and they were frustrated because nobody was able to give them a straight answer. And obviously the risk of the treatment that he got was was pretty high, and we couldn't promise them anything, but they took the chance for him because he was not able to be part of the decision. And the parents said, if he has a chance in this world, let's give him the steroids, let's give him that cyclophosphamide and try to save him. And I'm so happy that he was saved. I was amazed. I will tell you sincerely, I did not thought he's gonna make it, unfortunately, but he was saved.
That's awesome. So tell me, somebody with the training that you have, the expertise that you have, the experience you have, you got out of the traditional model to go into, more of a direct model. And can you tell us a little bit about, how expensive is it to see a doctor like you?
So the model that I want to create is all about access, transparency, and affordable model. And is not, I do not consider it's expensive. My prices are all transparent on my website. People can go in there and can look and decide. And it's not only about the cost of a consultation. I tried very hard and I was successful to bring down the cost of all the labs. You all know how expensive it is to do autoimmune labs. I was able to drop the prices down significantly, and the patients will know from the beginning how much it's going to cost them to do certain labs. If we have to do it all, because sometimes people or physicians, they just order everything because they want to make sure, they want to maximize that visit. But do you need all those labs? We can discuss, we can decide, okay, we can do this now, and we can wait to see what these labs will show, and we can proceed further to do the rest of them. I also was able to find solutions for imaging. You know how expensive is an MRI, right? Or a CAT scan. I was able to identify places in the states where I am licensed to offer them transparent prices for CAT scans or MRI or X-rays. And the same with medication. I was able to identify resources, pharmacies that will give cash price medication unbelievably cheaper than the traditional, pharmacy models. And I think that's the value. And then they have a direct connection with me. They don't have any middleman person. They want, they have a question, they can they can direct the question to me.
So do you have that's great. And, as a physician advocating for transparent pricing, imaging, pharmacy, labs, we've had, doctors like yourself that are more direct access type doctors. And it's amazing. The labs can be 10 times less expensive than
That's true.
normally.
That's very true.
Right.
Very true.
And, I don't think people realize, and I use the word expensive, and that was a bad term. What I should have asked is how affordable you can be, because these doctors like yourself that have gotten out of the traditional model, it's unbelievable how affordable you guys are.
Yes.
It's usually less than what we pay a month for our cell phone bills. I mean, honestly, seriously. So can you talk, are you fee for service? Are you or do you do a monthly membership model, or how does that work?
So at this point in time, because I started this practice a few months ago, the practice was conceived, I would say, through the course of the last year, but I started to see patients effectively at the beginning of September. I started to see patients, and my goal will be, at this point, I'm fee for service, but for patients that will require 3 visits per year, let's say patients with rheumatoid arthritis, they do require at least three times a year to be seen and have lab work to make sure that their body is not affected by the medication that we give them. Sorry, we have to have that kind of visits. And even for patients that are on biologics, insurance companies which approve the biologics, they will request an appointment with the physician to make sure that the medication is worthwhile to pay for it. So I will offer these patients a membership model, which will include the labs that they need. But it's just a projection for the near future.
Yeah. So what states are you licensed in?
Yes, I am licensed in Ohio, Indiana, Kentucky, and California. And I am waiting to be licensed. I applied for Arizona and Texas, but it's still a process, as you all know, to be approved.
And so I'm assuming you can do video. You're actually live in California, but you can do video conference with those patients in those states, correct?
Yes, I do telemedicine, and they can access me from everywhere. I mean, from their home, from their car. I had patients calling me from their car. But that convenience to have access to me when you need it, and you don't have to travel for 2 hours to see a specialist just for medication management. I always find that very tricky. I had patients when I lived in Cincinnati, I had patients from Indiana that were traveling about 2 hours to see me. Okay, so
right.
That was very hard for patients, not for me. I was seeing them 10 minutes, but I would have done that the same way just by talking to them on the phone, but it's better to see the person that you are talking to. It's better to see how they feel.
Right. So tell us, how do patients get a hold of you, Dr. Granita?
So they can call. They can call me. I have a phone number which is listed on my website, and they can also look on my website and try to schedule an appointment. They can find me very easily. I have a website.
What's your website?
So the website is called rheumatologistoncall.com, or it's my name. I have 2 domains. It's dianagurnitamd.com.
I think you have a Facebook page, Rheumatologist on Call, also, correct?
Yes, the Facebook page, I use that to educate people. It's my goal to have people reach out to me and ask questions, and it's my pleasure to educate patients about new things that are happening in rheumatology, to educate them about diseases, about treatments, and about lifestyle medicine. I always emphasize the importance of what you do besides medication.
Perfect. So, Dr. Granita, as we finish this podcast up, what fires you up about what you do?
I mean, I love patients and I love patient care, and the fact that you can give patients better care outside of the traditional models motivates me the most. I think that that kind of relationship that you develop with the patient as the healer is second to none, and that kind of reward that you get from patients, that they come to you very in a lot of pain and without hope. When you change that, that's tremendously that's a huge drive for me.
Awesome. I love that. You definitely, your passion comes across on this podcast. I can definitely tell that you're all about healing the patient, and that's just wonderful to see that you can take the time in the model that you have now, that you can take the time to really do that. So we are streaming your website as we speak, so patients can see that, potential patients and our listeners and viewers, of course. So that's awesome. Thank you so much for being on today, Dr. Granita. I really, really appreciate it. And that wraps up our show today. You've been listening to Health Solutions with Sean and Janet Needham. Tune in Monday, 1 to 2 p.m., where we have Tara Dawn. She is a counselor, and she'll be talking to us kind of about the mindfulness that we were talking about today. So it's a great time to transition into that, and it'll be a great topic. So thank you for listening. Health Solutions with Sean and Janet Needham.